Acetaminophen is a common household name found in nearly every medicine cabinet across the country. It's the active ingredient in popular pain relievers like Tylenol, which many of us turn to for quick relief. Millions of people rely on acetaminophen for headaches, fever, and other aches and pains. It's a staple in managing everyday discomforts. It's often considered a safe and effective over-the-counter solution for minor pain relief, recommended by pharmacists and trusted by families. Found in many medicine cabinets, acetaminophen is a go-to for quick relief. Its accessibility and effectiveness make it a popular choice. Its widespread use makes it all the more important to understand its potential effects. Researchers are constantly studying its impact on our health. While generally considered safe when used as directed, recent studies suggest there may be more to acetaminophen than meets the eye. These studies are uncovering new information about how it interacts with our bodies. Could this everyday pain reliever have hidden consequences for our behavior? Some research indicates that acetaminophen might affect our emotional responses and decision-making processes. As we learn more, it's crucial to stay informed about the medications we use regularly. Understanding the full scope of acetaminophen's effects can help us make better choices for our health. So next time you reach for that bottle of acetaminophen, remember to consider not just its benefits but also its potential risks. Knowledge is key to making informed decisions about our health. In 2020, researchers at The Ohio State University conducted a comprehensive study to explore a possible link between acetaminophen, a common over-the-counter pain reliever, and risk-taking behavior. This study aimed to delve deeper into the psychological effects of a medication that millions of people use daily. The study involved a diverse group of participants who were given either a standard dose of acetaminophen or a placebo. The participants were carefully selected to represent a wide range of demographics, ensuring that the results would be applicable to the general population. Neither the participants nor the researchers knew who received which, maintaining the integrity of the study. This method is crucial in eliminating bias and ensuring that the results are scientifically valid. This type of study is called a double-blind, placebo-controlled trial, and it's considered the gold standard for medical research. By keeping both the participants and the researchers in the dark about who is receiving the actual medication, the study can more accurately measure the true effects of the drug. The researchers meticulously analyzed the data to ensure that any observed effects were due to the acetaminophen itself and not simply the power of suggestion. They used advanced statistical methods to parse out the true impact of the medication on risk-taking behavior. With the placebo effect, people sometimes feel better simply because they believe they are receiving a treatment, even if it's fake. This psychological phenomenon can significantly influence the outcomes of medical studies, making it essential to account for it in research design. The findings of this study could have important implications for understanding how common medications like acetaminophen might influence our decision-making processes and risk-taking behaviors in everyday life. After taking either the acetaminophen or the placebo, participants engaged in a series of computer-simulated tasks designed to measure risk-taking. These tasks were carefully designed to simulate real-life decision-making scenarios, allowing researchers to observe how different substances might alter behavior. One task involved inflating a virtual balloon for monetary rewards. This task is known as the Balloon Analog Risk Task, or BART, and is widely used in psychological research to assess risk-taking behavior. The bigger the balloon, the bigger the potential reward. Participants had to decide how much to inflate the balloon to maximize their earnings without causing it to burst. However, inflating the balloon too much risked it bursting and losing any accumulated reward. This created a tension between the potential for higher rewards and the risk of losing everything. The researchers found that participants who took acetaminophen were more likely to take risks in the balloon task. They seemed less concerned about the possibility of the balloon bursting. They inflated the balloons more, even though it increased the chance of them bursting. This behavior was consistent across multiple trials, indicating a significant effect of the medication on risk perception. This behavior suggests that acetaminophen may influence how we perceive and respond to risk. The findings could have important implications for understanding how common medications affect decision-making processes in everyday life. Further research is needed to explore the underlying mechanisms and potential long-term effects. The study's findings raise questions about the psychological effects of acetaminophen. Could it be that the drug affects our emotional responses to risky situations? One theory is that acetaminophen might reduce anxiety. Anxiety is a natural response to potential threats and often keeps us from taking unnecessary risks. If acetaminophen dampens these anxiety signals, it could lead to less caution and more risk-taking behavior. However, more research is needed to confirm this theory and understand the exact mechanisms at play. Section 5. Beyond the surface. Exploring the psychological mechanisms at play. The Ohio State University study provides compelling evidence of a connection between acetaminophen and risk-taking. However, it's important to remember that correlation does not equal causation. Just because two things are linked doesn't mean one directly causes the other. Other factors could be contributing to the observed behavior. For example, the study didn't measure participants' baseline anxiety levels or their typical risk-taking tendencies. It's possible that people who are naturally less anxious or more prone to risk-taking are also more likely to use acetaminophen for pain relief. Section 6. The need for deeper understanding. Future research on acetaminophen's impact. More research is crucial to fully understand the relationship between acetaminophen and risk-taking. Future studies should explore the potential psychological and neurological mechanisms involved. Researchers need to investigate how acetaminophen interacts with the brain and whether it directly affects areas involved in decision-making, risk assessment, and emotional regulation. Longitudinal studies, which follow participants over an extended period, could also provide valuable insights into the long-term effects of regular acetaminophen use on risk-taking behavior. Section 7. Implications for consumers, navigating pain relief and potential risks. The findings of the Ohio State University study have important implications for consumers who regularly use acetaminophen. While the study doesn't suggest that everyone who takes acetaminophen will become a daredevil, it does highlight the need for awareness and caution. If you regularly use acetaminophen, especially in situations where risk assessment is crucial, it's important to be mindful of its potential effects on your behavior. This is particularly important for activities like driving, operating machinery, or making financial decisions. Section 8. Responsible use, weighing the benefits and risks of acetaminophen. Acetaminophen remains a valuable tool for pain relief. It's generally safe and effective when used as directed. However, as with any medication, it's essential to weigh the potential benefits against the potential risks. If you have concerns about the potential effects of acetaminophen on your behavior, talk to your doctor. They can help you assess your individual risk factors and explore alternative pain relief options if necessary. Section 9. The bigger picture. Understanding the complexities of pain relief drugs. The Ohio State University study serves as a reminder that even commonly used medications can have unexpected effects. It underscores the importance of ongoing research to better understand the complexities of pain relief drugs and their impact on our bodies and minds. As we learn more about the potential side effects of these medications, we can make more informed decisions about their use. Section 10. Moving forward. Informed choices and the future of pain management. The future of pain management relies on a multifaceted approach that includes continued research, open communication between healthcare providers and patients, and a commitment to responsible medication use. As we gain a deeper understanding of how pain relievers like acetaminophen affect our brains and behavior, we can develop safer and more effective strategies for managing pain while minimizing potential risks. Informed choices and ongoing research are crucial for improving pain management and promoting overall well-being.